The nurses' organisation has called a nationwide strike next month, saying the latest pay offer from Te Whatu Ora will cause another wave of nurses moving to Australia. The NZNO says the health system's in chaos, the government has forgotten about patients and has accountants running the health system. Senior reporter Juliet Speedy has more.
They're the front line of healthcare in this country.
They're upset, they're frustrated, they're absolutely fatigued and worn out. And they can't see it getting any better, you know.
And bargaining between Health New Zealand and the nurses' organisation has broken down.
We seem to have hit a hard place pretty quickly, actually, and around two critical issues. One is wages, and the other is safe staffing or staffing complements.
Te Whatu Ora has capped any increase at 1% of total employee costs, which would mean 0.5% in the first year.
We haven't nominated a figure, but what we say is it needs to recognise cost of living, otherwise it'll be a wage cut.
Nurses are also alarmed at plans to pause a digital staffing system used in hospitals to indicate how many full-time staff are required on duty at any given time. Health New Zealand told 3 News it values the enormous contribution of our nursing workforce and thanks them for their critical work. But we are disappointed that strike action is being taken so early in the bargaining process. Any settlement needs to reflect the ongoing reset of Health New Zealand as we work to get back to budget and complete the restructuring underway.
You've got 2 different models. You've got the accountant's model of how to run a health system, and then you've got the nurses' model, which is all about patients' care and well-being. And I think I know what most New Zealanders would want out of those 2 things.
And Paul Galter says without a better offer, more patients will suffer and more Kiwi nurses will flock offshore.
We will see a re-emergence of those people going over to Aussie. And why wouldn't they?
He says patients are being forgotten by the very government agency that's supposed to look after them.